Hello, I'm Dr. John Abebe, the Medical Director of the George Abebe Fertility Center and the lead tutor at the George Fertility Academy. It is my pleasure to be presenting you today the first online training program for nurses, the Fertility Training Program for Nurses. That is the title, and is powered by the George Fertility Academy. And this training program is in three parts. You have the first one, which is the online courses for nurses. And after they've completed that, you go on to the practical training program, and then you have the mentorship program. Now, the online courses for nurses have two parts. You have the basic fertility training course for nurses, which is online, which is for 4 to 6 weeks. And then you have the advanced fertility training course for nurses, which is also online for 6 weeks. And after you've completed that, then you now go on to the practical training program for nurses, which has to be done physically. You have to be attached to a fertility clinic. It consists of seminar courses during the training program with practical sessions. And then a logbook will be needed to be filled. And this is for about a 3 months period. Now, after you're done with the practical training session, you are now ready to engage hands-on to start working in a fertility clinic. But the training does not end. We have a mentorship program for nurses that is for 6 months to 12 months. And this will ensure the continuous teaching, learning, and hands-on training that will continue on the job. And the essence of this is to be able to provide our students with very comprehensive training, gather a lot of experience and skills, and ensure that they are well grounded in providing very comprehensive fertility care to our patients. Now, the mentorship program would of course commence after the students have completed successfully the online courses and then the practical training session. What is the objective of this training program for nurses? Now, the program objective is divided into three main objectives. You have the knowledge objectives, you have the skill objective, and then you have the professional development objective. Under the knowledge objective, the first objective is to, one, understand the reproductive medicine basics. And this will include the grasp the anatomy and the physiology of the male and the female reproductive system, understand the hormonal regulation of the menstrual cycle and ovulation, and identify common causes of infertility in both the men and the women. And two, objective under the knowledge objective is to comprehend diagnostic and treatment processes. One, to learn the steps that are involved in diagnosing infertility, including hormonal assay, imaging, and seminar analysis. And then to understand the various fertility treatments, the protocols, including ovulation induction, IUI, IVF, and the third-party reproduction. And then the third major objective under the knowledge objective is to develop ethical and emotional awareness. And this includes recognizing the ethical considerations and cultural sensitivity in fertility care, and to understand the physiological impact of infertility on patients and their families. So, under the skill objective, three objectives that we aim to achieve. So, one is to develop clinical competence. And so, to be able to, so with that, we hope to achieve the following: to be able to perform or assist in procedures such as transvaginal ultrasound and follicular monitoring, to administer fertility medications, including subcutaneous and intramuscular injection. 3, to educate patients on proper use and storage of medications. Now, As regards interpretation of diagnostic results, we hope to achieve the following to assist interpreting hormonal test results and imaging findings under the guidance of a physician, to monitor patients for treatment process and identify any potential complications such as ovarian hyperstimulation syndrome, OHSS. And then thirdly, to deliver comprehensive patient care. Under this, we aim to achieve, ensure patient education about infertility, treatment, and the process of assisted reproductive technology, and to provide empathic counseling and support for patients navigating emotional and medical challenges. And lastly, the professional development objectives, which again are divided into three. You have to collaborate in a multidisciplinary team, to work effectively with physicians, embryologists, lab technicians, and counselors in a fertility clinic, to be able to communicate clearly and professionally in a patient and team interaction. And then two, to follow regulatory and safety guidelines, to understand and to comply with clinic protocols, patient confidentiality, and legal guidance in reproductive medicine. And then to adhere to safety standards for handling specimen, medications, and equipment. And lastly, to build confidence and independence. And this includes gaining the confidence to play an active role in patient care and fertility treatment processes, and to develop the ability to handle routine and emergency situation in the fertility clinic. So these are the program objectives that we have gone through. Now, what is the requirement for application for training for the fertility training program for nurses? So educational requirement will include that all nurses applying must have a degree course in nursing. All right, an RON is not enough. A lot of nurses are going on to have their degree courses, and those who started off with their degree course are at an advantage. So we want to ensure that only nurses who already have gotten their degree in nursing are eligible to apply. And what is the other requirement? The only other requirement that is needed is a burning passion to develop a career in the field of reproductive medicine. And so I want to encourage you to quickly go to the registration portal, which is on the top right corner and register, and you would have begun your journey as a fertility nurse. So have a wonderful time, and I wish you all the best as you go through this training.